There are many dimensions to the management of NCDs and emergencies, but perhaps the one I'd like to focus on mainly is that of managing NCDs in the setting of protracted humanitarian crises in countries like Afghanistan and Sudan, Somalia, Yemen, Ethiopia, and so on. We know in these contexts that NCDs take an enormous toll, but it's often underappreciated and perhaps under the radar screen. There are 339 million people worldwide now caught up in humanitarian crises. But behind the numbers are the real human stories. And we know that the personal toll that NCDs can take on individuals and families is enormous. And there's few things more distressing, for example, than meeting a young woman with untreated breast cancer or cervical cancer, or meeting a middle-aged man who may have had a stroke and therefore unable to work and care for his family in a protracted setting where communities are so vulnerable. Some of the most stark images that I often come back with from some of these settings is that of biomedical workers trying to put their dialysis machines together and keep them working in a setting of very, very limited resources. So we can't forget the numbers, but we also can't forget the people. And we really do need to scale up our efforts to effectively address NCDs in these most difficult circumstances. We have to get the donors on board to assist us in that regard, because donors don't see this as a priority. They'd much rather focus on areas such as communicable diseases and sexual and reproductive health, which of course are important as well. But NCDs keep floating below the radar screen. We have to scale up our advocacy. We have to strengthen our efforts because this is one of the unrecognized crises of our time.